I became certified by the National Board of Physician Nutrition Specialists, and just other things as well along the way. Most of my time at UNM has been doing, my main job has been inpatient psychiatry. And so I've been working on the inpatient units at the mental health center. But my passion is nutrition and integrative medicine and mental health. So we have a few learning objectives here, and I just want to preface this by saying that I originally designed a talk kind of like this because I wanted to really make the case for the importance of nutrition in mental health with my colleagues, because other physicians tend to be not really, educated about it in medical school and tend to be a little bit skeptical about it. So a lot of this talk is kind of like here's more evidence to prove this. So what I have done is divided the talk, the beginning part of the talk is divided into different types of evidence that supports a role for nutrition in mental health. And then we're going to do a few other things along with, if there's time, reviewing a couple of case reports. These were patients that I had on the inpatient unit where I used a nutritional intervention for them, just as a way of kind of illustrating what I try to do. So, so there really is a growing volume of evidence in the literature that supports a link between nutrition or diet and mental health. And the first category of evidence that we'll be looking at are epidemiological studies. So these are basically studies that look at large groups of people. They examine what kind of food they're eating, and then they see if they can draw any kind of associations about what that type of diet does with their mental health. And before I get into that research, I did want to just explain what the Mediterranean diet is. And I'm sure many of us already, many of you probably already know, but there's a lot of research with the Mediterranean diet in not just mental health, but all aspects of health. And so I wanted to just kind of describe briefly up front what it is, because we'll be referring to it. So this is a diet that is very rich in fruits, vegetables, whole grains, beans, nuts, some fish, olive oil, small amounts of meat and dairy. Sometimes the dairy is yogurt, so it's fermented, as well as herbs and spices. So this type of diet provides high levels of fiber, a variety of different antioxidants, healthy fats, and sometimes probiotics if people eat yogurt. So the first study, I'm going to run through just some summaries of these studies. And I thought what I might do is, if it's okay, to just hold the questions till the end, if you happen to have a question or if I haven't made myself clear. So this was a study of 10,000 adults in Spain. They followed these folks for 4.5 years, just about. And then they checked to see how many people developed depression. So they found in this study that the more closely people adhered to a Mediterranean type of diet, the lower the risk for developing depression was. And here's another epidemiological study. This was 1,000+ women in Australia. They looked at their diets, sort of categorized them as far as degrees of healthiness. And they found that the healthier diets, and really these are sort of diets that are more like the Mediterranean diet, healthier diets were associated with significantly reduced risk of depression and anxiety. And there were actually many more that we're not going to go over, but take my word for it. There's lots of epidemiological studies, these large groups of people that they may follow over time. So the next category of research that provides evidence for this link between diet and mental health are what we call intervention studies. So this is where researchers get a group of people and they give one half of the group a particular diet, or maybe they give them a supplement or multivitamin or something, and then they give the other half either like a placebo or have some kind of control situation with them. So back to the Mediterranean diet. So here is one that, that had 67 participants. All of these people had major depressive disorder. What they did is they got half of these folks and they provided them education about the Mediterranean diet and included some nutritional counseling. The other half, which was the control group, had an equal number of meetings, but they didn't do any nutritional counseling. They just had what they called upbeat conversations and played games. And they found at the end of 12 weeks that the group that had the education about the Mediterranean diet had really significant improvements in their depression, and they used a scale called the MADRS scale compared to the control group. And most impressive was that the people who had had the information and the education about the Mediterranean diet, 32% of those folks had remission of their depression. That means they no longer met criteria for major depression. And in the control group that did not get the information or the counseling and the diet, only 8% had remission. So that's a pretty significant effect, likely due to the education about the diet. Lots of intervention studies have been done. Here's just a few examples I like to give. There was one that looked at 50 older men. They gave half of them a multivitamin, half of them got a placebo, and 8 weeks later, they found that the group that had the multivitamin had improvements in depression, anxiety, alertness, and in general functioning. The next study was a group of 231 prisoners. Half of this group got a multivitamin plus fish oil. Now, fish oil, and we'll talk about this more in a minute, fish oil is a source of a healthy type of fat called omega-3 fatty acids. So one group got the multivitamin plus fish oil, the other group got a placebo, and they found that in the group that got the multivitamin fish oil, there were 35% less antisocial offenses. And by this, it means like violent behaviors or getting into fights, damaging property. The group that had the placebo had no change in their behaviors. Another study with 290 children aged 11 to 12, they were being treated for behavioral problems like aggression. This group was given a fish oil plus a multivitamin. After 3 months, there was a significant reduction in their aggressive behaviors. And finally, one more. This is a group of 25 women. They switched from a standard diet, which had plenty of junk food in it, to a Mediterranean diet. And even after only 10 days, they reported their mood as improved compared to the group that didn't have any change in their diet. Here's another one that, this was a longer trial of this Mediterranean diet plus fish oil. It went for 6 months. So this is a group of 152 people with depression. One group got cooking classes. They actually gave them some hampers filled with groceries. They included fish oil capsules in this one. And then the control group attended some social support, but they didn't have the cooking classes. So after 6 months, the group that got the education about the Mediterranean diet showed significantly reduced depression scores compared to the control group. And in fact, they found that the closer they adhered to the Mediterranean diet, the better were their improvements in their depression. They also did blood tests, and they looked at their omega-3 fatty acid levels in their blood, and they found that the folks who had the higher levels of omega-3 fatty acids after these 6 months, that corresponded to less anxiety and improved quality of life. And then interestingly, they also found an effect on levels of pain and just general physical health too with the diet. So a little bit more about omega-3 fatty acids. So many years ago, scientists observed that in certain populations that consumed a lot of fish, there seemed to be lower rates of depression and suicide. So they began studying it. There have been many, many different research studies done on this. And And some of the research looked really promising that, yeah, there's something about omega-3 fats or fish that seems to really improve people's mood. And then other studies were not really that clear, they didn't necessarily show an improvement. So in 2016, someone gathered together 13 studies to just kind of look at the whole volume of evidence together. And after they examined these 13 studies, they made a conclusion that yes, indeed, omega-3 fatty acid supplements do indeed have an antidepressant effect. But this effect is especially pronounced if the omega-3 fatty acid has what's called EPA, and we can talk about that if you have questions. There's different kinds of omega-3s. So higher levels of EPA were a little bit more effective for depression. And the effect was especially strong if you gave people a fish oil or omega-3 supplement along with their antidepressant medicine. This study I find very fascinating because I work with a lot of people with chronic psychotic disorders on the inpatient units. So my interest is always piqued when I hear something about nutrition and psychosis. So this was a study published in kind of one of our bigger journals in 2010. And researchers had identified 76 young people who were felt to be at very high risk for developing schizophrenia. So these were young people that were maybe showing some mild symptoms of psychosis. Maybe they also had a first-degree relative with schizophrenia, but they hadn't really developed full-blown schizophrenia. They were just felt to be at risk. So they divided the group into two. One group got a fish oil supplement, and they took that for 12 weeks. The other group got a placebo. It was identical. It just looked like, oil. They also did blood tests to check on the starting point omega-3 fatty acid levels of all the people in the study. So the fish oil supplement was only given for 4 months, but after 12 months, they went back and looked at all of the participants, and they found that in the group that had gotten the fish oil, 4.9% had transitioned to full-blown psychosis. But in the group that had gotten the placebo, it was 27.5% who had transitioned to full-blown psychosis. So their conclusion was that the omega-3 fatty acid supplementation appeared to reduce the rate of transition to psychosis by 29%. And this is a little bit controversial. This research has not been replicated. They did do a big study, but there was a flaw in the study, which I pointed out, and my letter was published because they had made a flaw in their research. So since then, no one has really been able to create a large enough study to replicate this result. But I feel that this is important enough, even though it's a small group and it's only one study. I always try to provide this education to the families of young patients who are potentially developing psychosis. Okay, so the next category of evidence to support the link between diet and mental health is the sort of burgeoning area of research on inflammation. So we're now finding that inflammation seems to be a root cause for lots and lots of different human diseases. And it also is being found to be a root cause, or at least an important factor in the development of psychiatric illness. So here I have I'm trying to explain sort of a connection between our standard American diet, which tends to be very high in processed foods, lots of sugar, omega-6 fatty acids, which are felt to be more inflammatory, trans fats, which are also kind of potentially damaging, low in all of the good stuff that the Mediterranean diet has, like low in plants. This standard American diet, or otherwise known as the SAD, seems to be related to increasing inflammation in the body. And we know that because we can do blood tests that check for markers of inflammation. And there's a number of different ones that you'll see and if you read different papers on this. But there's a variety of markers that we check for in the blood that will tell us kind of the level of inflammation in somebody's body. So the standard American diet seems to increase these markers of inflammation, and these markers of inflammation are clearly associated with diabetes, cardiovascular disease, high blood pressure, obesity, and other medical illnesses. And now research is also showing that these markers of inflammation are associated with depression and anxiety, psychosis, and mania. And what I like about this, though, is that I know inflammation is really damaging, and there's a lot of it going on in lots of people's bodies, but it actually is modulated by changing our diets. And so we know that diets that are very low, and they've studied this specifically, low in omega-3s, magnesium, vitamin A, vitamin C, and vitamin E, these are associated with higher levels of inflammatory markers. And even just eating one fast food meal can lead to increases in these inflammatory markers, which then has been linked to increased risk for heart disease. And then when you get people to switch to a Mediterranean type of diet, and you check their blood again, it shows that their inflammatory markers have gotten lower. So there's lots of research looking at these blood levels of inflammatory markers, and I summarized just a couple out of, probably hundreds. But there is a study that found that in people who have a psychotic disorder, if they also have high levels of inflammatory markers, it tends to mean that their psychotic symptoms are more severe. In a study with pregnant women, they looked for an inflammatory marker called TNF-alpha, and they found that when that was elevated, that the baby had an 8 times greater risk of developing schizophrenia later on. We know that in general, people with major depressive disorder have higher levels of inflammatory markers compared to people without major depression. But also the very high levels of these inflammatory markers are also make it more likely that that depression will not respond very well to medication. They've done some studies just giving very kind of standard NSAIDs medications, which are non-steroidal anti-inflammatory medications. This would be medicines like ibuprofen, for example. Though medicines in that category can actually reduce some aspects of psychotic symptoms. And this is a very small study that also has not been replicated, but I think it's still interesting. A small group of people with schizophrenia were given curcumin, which is a component of turmeric. It was given along with their antipsychotic medication compared to a placebo. And it turned out that their inflammatory marker levels went down, and some of their cognitive functioning improved. In this case, it was their working memory. Not all the symptoms of psychosis were improved, but at least their memory was improved compared to the group that got the placebo. So the next category of research is just that we have more and more research in brain physiology. And the more we delve into that physiology, we find that nutrients are required for healthy brain function. So I wanted to introduce the concept of that we call oxidative damage. And you might come across this if you read any papers on nutrition. So basically, this is about the fact that our brains consume a lot of oxygen. So of all the oxygen that we breathe in, that we use by our body, 20% of it is consumed by the brain. And just a very normal byproduct of oxygen, that as it goes through its normal metabolic processes in the brain, it normally creates these things called reactive oxygen species, and these are abbreviated as ROS. So these reactive oxygen species, if they're allowed to accumulate, they can actually cause damage to brain cell membranes, to DNA and RNA and proteins. And you can think of it as kind of like causing rust damage. It's like oxidative damage is basically like rust. Now, in a brain that is well nourished, there'll be plenty of nutrients there that their job is to neutralize these reactive oxygen species along with other toxins too, preventing them from being damaging. But brains that are poorly nourished are more prone to damage from these reactive oxygen species because they don't have all of these nutrients readily available to neutralize these byproducts. So there's, many, many nutrients that are important for the brain. A few that are particularly noteworthy for preventing oxidative damage, this rusting of the brain, are vitamins E, vitamin C, the carotenoids, selenium, and certain amino acids. Magnesium is also especially important for preventing damage in the brain just from normal metabolic functions, because it modulates the activity of a neurotransmitter called glutamate, which is necessary and important. It performs very important functions in the brain, but if it accumulates, it can be toxic. So magnesium helps modulate that, and it gets rid of excess glutamate. I put in a couple of pictures here just as an example. Dark chocolate happens to be a good source of magnesium, so that's a good reason to eat chocolate. A particularly good source of vitamin E is sunflower seeds or sunflower oil. And we can go over other nutrients that are in foods later if you like. More nutrients that keep our brains healthy. So in order for our brains to produce enough energy, we need all the B vitamins. We need various different types of fats as well. In order to synthesize neurotransmitters like serotonin, dopamine, glutamate, and norepinephrine, we need a variety of nutrients, including vitamin C, folate, magnesium. Also the B vitamins, I left that one out. We talked a little bit about sort of this oxidative damage in the brain. So we need, again, vitamin C, vitamin E, magnesium, some amino acids. The plant polyphenols, these are components in plants, things like anthocyanins and carotenoids, the things that give plants their vivid colors. Those turn out to have a very powerful antioxidant effects in our bodies and our brains. The immune system in the brain requires plenty of vitamin D, zinc, vitamin C, and these are just examples. There's others as well. So often when I talk to my colleagues or other physicians and residents and medical students, I hear this mythology that, oh, the US, it's such a wealthy country, we don't have to worry about nutritional deficiencies here. Our diets are just fine. Well, I would argue that that's not true. In fact, many people do not consume adequate amounts of nutrients. And the fact is that people who are impoverished or live in lower socioeconomic classes, people with chronic diseases, including medical and psychiatric diseases, these are risk factors for poor nutrition. And this graph came from the USDA several years ago. And what it is the numbers in the columns. So if you look at the first arrow up there where it says 18.7, that corresponds to vitamin E in New Mexico. And that means that of all the people in New Mexico, only 18.7% of the New Mexico population obtains adequate vitamin E in their diet. So all those folks who don't are going to be a little bit more susceptible to this oxidative damage in their brains, which might make them a little bit more at risk for mental illness. And I pointed out another example here. There's calcium. Only 27.1% of people in New Mexico obtain adequate calcium in their diets. But you can see that there's lots of areas that are that are pretty low. Vitamin A, only about 40% of New Mexicans obtain an adequate amount in their diet. So this is kind of how I counter that argument that, oh no, we're all fine here. We all have good diets. It's really not true. And I see it all the time on the inpatient unit. And especially when I talk to my folks with severe mental illness and I ask them about their diet, I mean, some people, they go years without eating a vegetable. It's fast food or chips and Mountain Dew and so I think their numbers would be a lot worse if we could quantify that as far as their diet quality. So the last category of evidence is really related to just our well-established literature. Some of this is just things that we learn in medical school that we all kind of memorize, like, oh yeah, and some of these may be actually even familiar to you guys. So these are some common ones, like a thiamine deficiency, which we sometimes see in people with chronic alcoholism, can lead to a type of delirium called Wernicke-Korsakoff syndrome. Vitamin B12 deficiency can lead to depression and even psychotic symptoms in some cases. Folate deficiency can lead to depression and dementia. Niacin deficiency can lead to dementia and hallucinations. Vitamin B6 deficiency can lead to depression, and iron deficiency can lead to depression. And then there's a lot more. And these are just less well known, but have been studied, and there's definitely strong evidence to support these, that zinc deficiency can cause symptoms of ADHD. Zinc deficiency can also lead to depression. And we've now learned that omega-3 fatty acid deficiencies can lead to depression, as well as irritability and symptoms of ADHD. Magnesium deficiency can lead to anxiety, depression, mania, and it makes it harder for folks who are trying to get off of opiates. So it makes it harder to stay sober if you're fighting an opiate addiction. Chromium deficiency can lead to depression. Vitamin D deficiency can lead to symptoms of ADHD, insomnia, depression. It can cause problems in memory and other cognitive dysfunctions. And we'll go over some of these interesting research about schizophrenia and its connections with vitamin D. Vitamin C deficiency can cause depression and anxiety, and selenium deficiency can cause depression. It's especially been studied in postpartum depression. So that means depression either before or right after a woman has a baby. Those are just the sources for that. And then I'm going to move on to one of my cases. Let me check my time. Okay. So I want to make sure we have time for questions at the end. So this is just one example. There are so many nutrients out there, but this one I just thought was a good place to start to explain some of the brain effects of vitamin C. So this was a patient that I had several years ago on the inpatient unit. She was a married female, 45 years old, and she had been admitted 4 times into the psychiatric hospital over the past 8 months, each time with severe depression, with psychotic features and some catatonic features as well. She came in with the very classic symptoms that we see in folks with severe depression. Very low energy. She was very, very sad. She had no appetite. She had lost a significant amount of weight. And in her case, she also was hearing some voices. She was preoccupied with death. And one time she had been thinking about suicide. And one time she actually did attempt suicide by cutting her wrists on one of her hospitalizations. So every time we brought her in the hospital, we would give her medication and she would improve. Her mood would improve, the hallucinations went away, catatonia improved, but it seemed that she would decompensate shortly after returning home. We also gave her ECT on her 3rd and 4th hospital stays because each time she came in, her symptoms seemed to be worse. On the fourth admission, I said, I'm going to look a little deeper in this poor woman's situation, and I ordered a few vitamin levels, and I found that her vitamin C level was in the deficient range. Now, interestingly, she didn't show any of kind of the obvious signs of deficiency, but she was still deficient in vitamin C. And so we added vitamin C to her medication regimen. We provided education about diet, talked to her and her husband. And this was years ago, and we have not had to readmit her since then. Now, I don't know 100% for sure. I can't say that it's certainly that was the thing that made the difference, but it's possible that it certainly played a role in her repeated hospitalizations. So a bit about vitamin C. So you may know this already. Humans cannot synthesize vitamin C. We have to consume it in our diets. And according to that chart I showed you a couple minutes ago, only about 51% of people in New Mexico consume the recommended amount of vitamin C. The prevalence of vitamin C deficiency in the overall US population is 7%. Anybody who smokes is at higher risk for developing vitamin C deficiency, and also people who are of lower income. Vitamin C deficiency occurs frequently in the severely mentally ill population, and I say this because for a while I was checking vitamin C levels on lots of my folks, and I frequently found vitamin C deficiencies in the folks that were coming into the hospital with severe mental illness. So vitamin C has a number of functions. It is required to make collagen. So collagen is a protein that is in our skin and is in our gums. So you need enough vitamin C to heal any kind of wounds or to keep your gums healthy so you don't lose your teeth. Vitamin C is also required to make a stress hormone called cortisol. And it also is required to make dopamine, norepinephrine, serotonin, and a couple other hormones, prolactin and oxytocin. And what I like to teach the residents and the medical students is that vitamin C is really the vitamin that we need to manage stress in any setting in order to bounce back from a surgery, a trauma, a depression, a loss, an accident, an injury, a wound, any kind of stress, whether it's emotional or physical. Vitamin C, you need plenty of vitamin C in order to bounce back from that. Physical symptoms of vitamin C deficiency, and we may not even see these, but I often do point this out to my residents that if they see somebody with bruising or a wound that doesn't seem to heal, or these little spots called petechiae. These are really just little tiny bleeds little tiny bruises under the skin. Or if they have bleeding gums, or they've lost a lot of teeth, or they have wounds that they've had a long time that aren't healing. These are very classic signs of vitamin C deficiency. And the psychiatric symptoms could be depressed mood, anxiety, fatigue, irritability. And personally, I can't back this up with research, but I think that anybody with any psychiatric symptoms, if they have a vitamin C deficiency on top of that, I would imagine that this would just make everything feel worse. These are just more risk factors for vitamin C deficiency. So any kind of physical pain, trauma, surgery. And when they've looked at folks who are in the main hospital, so these are not psychiatric patients, but just medically hospitalized for any reason, about 60% of people in the hospital have either very low vitamin C levels or are frankly deficient in vitamin C. I think I mentioned smoking is a risk factor. An exposure to any kind of pollution or toxins. The use of stimulant drugs actually increases the risk of vitamin C. So we see this in our folks who have methamphetamine use disorder and come into the hospital. We'll often see they've lost a bunch of teeth, they have bruises, things are not healing. So the use of stimulants increases the risk for vitamin C deficiency. And of course, anybody with a diet that is low in fruits or vegetables. So in the brain, I think I know I mentioned this already, but vitamin C is one of the major nutrients needed to neutralize those really toxic reactive oxygen species. So you need plenty of vitamin C to protect your cell membranes, to protect your DNA and your RNA. And also there was a study that looked at, there is a little bit of damage that can occur with antipsychotic medications, even though, of course, we want our people who need antipsychotic medications to stay on antipsychotic medications. So it turns out that vitamin C will mitigate that, any kind of toxicity related to the use of antipsychotic medications. At least that study was done in rats. It hasn't been shown in humans yet. I also teach my residents that vitamin C, along with a lot of other nutrients actually, are needed in order for our brains to produce serotonin, dopamine, and norepinephrine. And many of us are familiar with these neurotransmitters because they're so important in keeping our moods good and keeping depression under control. So if somebody has a poor response to an antidepressant, it's possible that it could be related to vitamin C deficiency. So that's just something to think about. They did a small study with children who had depression, and all of these children were given Prozac for their depression. Half of the children were given vitamin C along with the Prozac, and then half got a placebo. They found that of the kids who got the vitamin C, they had a stronger response to the antidepressant compared to the group that got the placebo. A little bit more about vitamin C. They did studies where if you just go into the hospital and you just give people vitamin C, it seems to improve their level of distress. They did a study with medical students. The medical students who were given vitamin C reported reduced anxiety. And this one I threw in, I just have no idea why somebody decided to study this, but someone did a study with high dose vitamin C, 3,000 milligrams, and they gave this vitamin C to couples for 2 weeks. And they found out that compared to placebo, the couples that got the high dose vitamin C had an increased frequency of sexual intercourse and reported improved mood compared to the placebo group. So just for fun, I included that one in there. And I recommend to my residents and medical students to please, check a diet history of your patients. Just find out what kind of diet does the person have. Do they include fruits and vegetables? Remember the risk factors for vitamin C deficiency, like stress, pain, smoking, poor diet. It's important to do a physical exam, and it's important for physicians to remember to, provide education about healthy lifestyle, including diet. And let me just check my time here. I have one more case, and then we can take some time for questions. Okay, so this next patient came into the inpatient unit. He was a 40-year-old male. He had a chronic history of schizophrenia. He had been doing well for a long time. He was stable for many years on the same medication, but he had suddenly came in with an acute psychotic decompensation, and he had even made a recent suicide attempt. He promised us he was taking his psychiatric medications as prescribed, and this was confirmed by his mother. So he had his symptoms were very distressing auditory hallucinations. He had anxiety. He feared his mother may die and leave him alone. And most interestingly to me, he complained about this generalized muscle pain. He said it's been lasting for about 6 months. He felt this pain was in all his muscles and his bones, especially his calves. When I asked him about his mood, he said, "My mood is one big bruise." The pain was severe enough to wake him up, and there was really no triggering event that we could determine. He hadn't been in an accident, or he wasn't exercising. And he was taking Tylenol and ibuprofen, but it didn't really do that much. There was nothing really remarkable on our physical exam. So we did some labs. We found a few different things that were going on with, he was clearly not well nourished. He had mild anemia. He had a low B12 level. His calcium level was low. Magnesium level was low. One of the B vitamins, thiamine, was low. So this really told me that he really doesn't eat a very healthy diet. He was also on a medicine that blocked acid. In his case, it was omeprazole. And this actually can cause problems with absorption of certain nutrients. But the one that I wanted to point out was that his vitamin D level was very, very low. It was 9, and it was supposed to be between 30 and 100. So he clearly was not going outside in the sunshine or eating foods that were high in vitamin D. So all we did was continue the same antipsychotic medication, but we added a multivitamin with iron. We added some vitamin C because I tend to always do that. And we put him on a pretty good dose of vitamin D. And after 3 days, the pain that had been there for 6 months had resolved. And when the pain resolved, his anxiety was fine. And then his psychosis also improved. So he was stable and ready to be discharged home after only 5 days in the hospital. So I think it's a situation where it's hard to know exactly what was going on. There were several different nutritional issues happening with him. And so it's hard, maybe some of those were contributing. My strong suspicion is that he had a vitamin D deficiency, which was causing him pain. And then the pain was so distressing that it caused his decompensation. So I use that just as a kind of a jumping off point to talk a bit about vitamin D. So overall in the US, the prevalence of vitamin D deficiency is 42%. However, among African Americans, the prevalence is 82%. Among Hispanic Americans, the prevalence of vitamin D deficiency is 69%. It's more common in people with obesity, just overall poor health, people who have high blood pressure or who are less educated. And the prevalence of vitamin D deficiency in people with schizophrenia is about 65%. So that's pretty significant. The risk factors for vitamin D deficiency, one of the main ones is just being a shut-in, just staying indoors. Older age, kidney disease, gastrointestinal problems, pregnancy. And if you don't eat enough magnesium, that will also contribute potentially to a low vitamin D level. So signs and symptoms of vitamin D deficiency. So these are sort of the general physical symptoms. So the one that's most well known is that it can cause your bones to not be very well mineralized. So your bones can be weak, but it can also cause muscle pain and weakness. In one study that some neurologists did with people who had chronic generalized muscle pain was just give them vitamin D. And they found that in most of these patients, their pain improved significantly with just getting a vitamin D supplement. But vitamin D deficiency can often be asymptomatic. There may be no signs or symptoms. Other things that vitamin D does in the body, it maintains your calcium levels. I already mentioned it promotes bone mineralization, but it's also important in managing and modulating the immune system. It also plays a role in glucose and insulin levels. It plays a role in blood pressure, and it may even be implicated in managing or preventing certain cancers. In the brain, it has not been fully researched yet. We know that vitamin D has numerous functions in the brain because we see, not me, but researchers have found areas of the brain with high concentrations of vitamin D receptors. So we know the vitamin D is attaching to those receptors and doing something. We know it regulates activity of many different genes. It's involved in the differentiation of brain cells, growing parts of the brain cells, signaling between brain cells. It seems to stimulate certain brain growth factors. We know that vitamin D plays a role with dopamine and serotonin. We know it's involved in mood regulation, sleep disorders, and when it's deficient, you can have ADHD symptoms, and it may increase the risk of developing schizophrenia in offspring of women who are deficient. This was an interesting little study. A group of 90 children who were on methylphenidate, which is Ritalin, for ADHD. They checked their vitamin D levels, and then they gave everybody either a placebo or a vitamin D supplement for 8 weeks. When they assessed their level of ADHD, they found that the ones who had the low vitamin D levels in the beginning, their ADHD symptoms really significantly improved with the supplementation. So we know it's playing a role there. I don't think they've had the details really all sorted out. And then this I find very interesting. This is a study from Denmark where I guess everyone that's born in Denmark, they take a blood sample and then they bank them. Like they keep blood samples on every single infant that's born so they can do some studies on this. So they found that what they did is they found 424 adults who had schizophrenia, and then they matched them with a group of adults without schizophrenia. Then they went back to the blood samples that were drawn when they were infants. And what they found was that if the infant had a very, very low level of vitamin D, there was a 2 times greater risk of later developing schizophrenia. But they also found that in some of the infants that had very, very high levels of vitamin D, that was also associated with increased risk for developing schizophrenia. So there's kind of a sweet spot with the vitamin D. We don't want it to be too high or too low. This other study from Finland, they looked at 12,000 infants, and they determined that in the infants who were given vitamin D supplements while they were during their first year of their life, that was associated with a reduced risk of developing schizophrenia later on. Although this was just in males. For some reason, that association didn't happen with females. There's definitely something going on there with vitamin D and psychosis. Severe vitamin D deficiency is associated with a slightly increased risk for developing first episode psychosis. If a person does have a first episode of schizophrenia, having low vitamin D levels predicts more severe symptoms and more cognitive deficits. And in mentally ill adolescents, the study found that those with a vitamin D deficiency were 3.5 times more likely to have psychotic features. So again, this is kind of my recommendations to some of the other physicians that I talk to. Just, get a diet history, ask about outdoor time, remember the risk factors for vitamin D deficiency, take a test, or, patients should maybe consider asking their doctors if the doctor doesn't think of it to get a screening test for vitamin D. And then of course as physicians, we should be providing education about the importance of a healthy diet, being outdoors, getting a little sunshine. So I think this is my last slide. Just wanted to say that, so those were just 2 examples out of many, the vitamin C and the vitamin D. So, really every nutrient has some role in the brain. And we haven't maybe figured out all the details yet. So it really is not possible to target specific symptoms necessarily and say like, oh, you're having this symptom, you should take this vitamin. So really I can just recommend that we work towards, all of us should be kind of trying to work towards including lots and lots of different plants in our diet, and just keeping the processed foods down to a minimum. And really that Mediterranean style diet is one example of a healthy diet that, if we could kind of work in that direction, that would probably provide a lot of, provide a lot of nutrients that we need for brain health. So I guess that's my last slide. So I'm available for any questions.
Well, first of all, Dr. Lin, I'd like to thank you very much for your presentation. Lots and lots of very, very useful information and insights, as well as your final recommendation, which I think, I certainly found valuable. I want to throw it open for questions. And Jess, if you could let me know if we pick up any questions off the Facebook feed.
There was one. Would you recommend taking a supplement like Emergency?
Well, yeah, most of the time I would, to be honest. I think most of us are exposed to stress. Even if we don't smoke, we walk outside and we're exposed to car exhaust. Most of us have a lot going on in our lives that contributes to our stress, which will then increase our need for vitamin C. And in most cases, taking a vitamin C supplement is not dangerous. There are a few cases, for example, of people with severe like kidney stones. You want to not overdo the vitamin C supplements, but taking something like what I think Emergency has, like maybe 500 milligrams or 1,000 milligrams. I often do that for myself if I'm going to be traveling or something like that and being exposed to airplane exhaust. So I think in most cases it's safe. It may not help much, but it doesn't hurt, and it provides a little extra assurance in certain situations.
Excellent. Thank you.
Can I ask a question?
Craig had his hand up first, and then we'll go to you. Go ahead,
Thanks,
Craig.
Tom. Thanks, Dr. Lin, for your talk. Really appreciated the content and everything you went over. And I have to confess, with the title of the talk, I never thought I'd find out that high dosages of vitamin C may be an aphrodisiac. That's like fascinating. But I wanted to ask you if you're aware of research related to high caffeine intake and mental health and mental illness. And I'd say I'm asking for a friend, but I'm actually asking for myself.
Gotcha. That's a really good question. And, to be honest, we're not very good about asking our patients about their caffeine intake. So I can't say that I've read a lot of research on it. I think there was one paper that I remember about a patient that just had consumed just really intense, crazy amounts of caffeine. Like I think they were taking caffeine pills like no-dose or something, and they developed psychosis.
Yeah.
But I suspect that that's a factor in more times than we are aware of it in people that talk about, they're not sleeping well, they're anxious, they're jittery. We probably don't ask enough about that. But any stimulant, whether it's caffeine or one of the stronger stimulants like, cocaine or methamphetamine, any stimulant at a high enough dose can contribute to not only anxiety and insomnia, but could theoretically cause psychosis.
Yeah.
So it's probably good to kind of keep an eye on that.
Okay. Thank you.
Thank you. Let's see. Mr. Smith?
Yeah, I was wondering how difficult it is to test for vitamin C and vitamin D. And if it's not too difficult, would it make sense to have, perhaps programs in the schools where kids could be tested, particularly some of the lower income schools here in Santa Fe where the deficiency might be more prevalent? Could you have a testing program and identify kids when they're pretty young?
I love that idea. I love it. I don't know. Yeah, I've never even thought of that before, but that would be it is very simple.
Okay.
And I like that because the vitamin D, because of the learning issues associated with vitamin D deficiency. I love that idea.
Oh. Good.
And
Thank you.
Yeah.
Cam, did you have your hand up for a question?
I sure did. Thanks, Tom. And thanks, Dr. Lin, for the great presentation. There's a lot there. And I captured as much information as I could from just by writing notes, but I really enjoyed the slides. And my question is about the behavioral aspect of diet. And so with depression, in my experience, weight loss or weight gain can be related, either binging on foods or or not having appetite and then losing weight. And so I'm curious how we treat those so that people have more desire beyond the simple economic aspects of access to good food, have more desire to take on a healthy diet.
That is a tough one. That really is a tough one. I mean, I think, the first step is to provide some education. So, if the person is open to hearing it, and if they're, not all people, some people with depression, they're just so shut down that you can't even really they're just not able to hear that kind of information. But so sometimes, all we can do is just give some medication and hope that kind of starts to move things in a direction where then we can provide the education. But I know from working with so many depressed folks that, they might even already know that they need good nutrition to feel better. But when someone is so depressed like that, they just don't have the motivation to go and try to eat healthy. Maybe just getting someone to, at least in those situations, I think a healthy diet is much better than a supplement, but even just, having them try to take a multivitamin once a day, and then getting them on, hopefully an effective medication that will help them move in that direction. But it's a tough one. There are some medications that stimulate appetite. So we do sometimes utilize those in the hopes that it'll get them hungry and wanting to eat. Sometimes it works, sometimes it doesn't. It's a tough one. I don't have a simple answer for that.
Thank you. That's helpful.
I have a related question, Doctor.
Just a second, Terry, I had one person before you. Miss Tati?
Oh, thank you. Yes, thank you, Dr. Lin. As I said, I emailed, I texted, very insightful. I really appreciate. I have a brother, 60-year-old, and he's suffering, aside from all the mental diseases that you mentioned, and I'm gonna emphasize on his diet when I see him and bring him all those vitamins. He also suffers from contracture bent fingers, like this. Something. And so I was wondering, for that particular, is there something specific like collagen, or I don't know?
Well, the first, obviously I cannot, diagnose what's going on with your brother just with that information. He's not my patient, so I can't provide this. This is not a diagnosis.
I understand.
But the first nutrient that comes to mind when you're talking about any kind of like muscle spasm,
yes,
is magnesium. Calcium and magnesium are both required for like normal muscle movements. So calcium is needed for contracting your muscles, and then magnesium is needed for relaxing your muscles. And actually, there's people that just take a lot of calcium and they get muscle cramps, and they think, oh, I better take more calcium, I'm having muscle cramps. Well, it turns out you have to have a balance between the magnesium and the calcium. But I have no idea if that's really what's happening. And so obviously, he needs to talk to his doctor. But
I understand. Yeah.
That's my first thought when I hear that about muscle spasm.
Thank you very much, Dr. Lin. Terry, question?
Yeah, I really appreciate this topic in your presentation, Doctor. And a question for you. You mentioned that sometimes your patients that you try to work with on diet are just not able to really hear the message. Mm-hmm. And you didn't touch on, but I think it would be remiss if we didn't acknowledge that in our culture that a lot of our dietary preferences are due to, in addition to lack of education, they're due to lack of availability and the addictions that are created by the processed foods. So with all of that as a baseline, changing people's habits is hard. And I've just found in my own life that sometimes you don't do a wholesale change. You implement incremental changes. And if I were to ask you what would be the most impactful dietary or supplemental change or changes that you would recommend to get people started on a better path, what would your answer be?
That's a really good question. You know, I think I would really have to talk with the patient and just kind of find out, you know, culturally, what would be an easier change for them. You know, like if you really get to know the patient, you find out, well, what do they normally eat? You know, like maybe they drink Cokes 3 times a day or something. Like, well, what if I said, well, what about if you, instead of drinking Cokes, you switched it to purple grape juice? So at least you're getting some of those anthocyanins, some of those antioxidants. Maybe it's fortified with vitamin C, so you're getting a little bit of that. So you kind of have to customize it with each patient. So it takes really getting to know the patient. I don't think there's one answer that's going to work for everybody. And then, you know, and then there's times where, you know, they really are just resistant to anything. And I might say, well, would you be willing to go get a chewable vitamin, like just take a Flintstone vitamin once a day? So at least they're just getting a little something to start with. You know, or just if they could add 1 carrot to their diet, you know, like we decide what's 1 vegetable that you can tolerate maybe, and you know, or can they make a smoothie and put a handful of spinach in it, or so. But it really has to be kind of, I think, customized for each patient, each person.
That makes sense.
Thank you very much. Camilla, question.
Hi, yes, good to see you, Tom. Dr. Lin, I really very much appreciate this conversation. And the thing that comes to mind, if you have someone who is going through an ECT treatment, has there been any work or studies that have been done on, you know, that's very harsh. It can really, I mean, it takes a lot out of a person post-treatment. And I'm wondering if there have been studies to see what the deficiencies are pre and post ECT. And then for those who are preparing to go through the treatment or in treatment, what types of intake should they, you know, what would you prescribe, if you will?
Well, I mean, you know, the first nutrient that comes to mind there is vitamin C, because first of all, if they're going through something that's so severe that requires ECT, then that means they're under a lot of duress and stress or anxiety, or they're having catatonia or mania or whatever it is that is requiring the ECT. That is going to put a lot of stress on all of the water-soluble vitamins, but especially vitamin C. So I would absolutely want that person to be on, you know, like at least 500 milligrams of vitamin C a day, you know, moving up to the ECT and then during the course. But probably also the B vitamins. I'll often in the hospital, we have a option of doing a combination. It's a B vitamin with vitamin C, and I'll often give that to folks before they have their ECT, because all the B vitamins are so necessary for the brain to just do so many of its functions, including manage its energy levels. So those would be places to start with, especially if there's you can't just suddenly change your diet to a beautiful Mediterranean diet, like, you know, most of us really are not able to do that, or don't have the resources. So that would be a simple thing to start with, is vitamin C and B vitamins.
Thank you very much.
Excellent. Do we have any other questions? Jessica?
More from Facebook.
Go for it.
Okay, one, you mentioned too much vitamin D might be an issue. How much is too much?
This is a little bit tricky. Vitamin D is a fat-soluble vitamin, and it turns out that it's like people who are very heavy, who have a lot of adipose tissue, need to take more in, because it kind of gets diluted in the body. So someone with a big body is probably going to need more than someone with a skinny body. Or if you are, you suddenly gain weight, that could cause a deficiency. Or if you suddenly lose weight, you might have a little bit more. So you really, that's a nutrient that, you know, if you're someone who's not really outside in the sun, you know, ideally all the doctors should be testing vitamin D levels. I mean, really, there's so many reasons to just test it now. All of us should be testing that. But having said that, if your doctor won't do it, and you don't know if you're deficient or not, they have found that everybody can take 4,000 international units of vitamin D3, and that won't lead to any toxicity. Ideally, if you're taking that, you should still, you know, get tested beforehand and then have your doctor do a follow-up test maybe 6 weeks later. But you would have to take, in order to get toxic on vitamin D for most people, I mean, unless you're a real skinny person, you would have to take like more than 10,000 units a day for a long period of time. So most people are going to be fine if they take up to 4,000 units a day, but it would be best to get it tested.
Thank you, Dr. Lin. Anything else, Jessica?
The last question I have is, what would you think of a brain supplement like HTP?
Okay, so 5-HTP is actually it's a derivative of tryptophan, which is a precursor for serotonin. And you know, the research, to my knowledge, is a little mixed on that. It's not going to hurt to take a little bit for most people, but it may not help. Typically, people are taking that for anxiety or depression or sleep. And so it's, you know, if you're just taking an amount that's kind of over the counter, you know, I would really, you know, recommend trying to get it from a really reputable source. There's a couple of vitamin manufacturers that I think are very trustworthy, but there's a lot out there that are not. But if you can get it from a reputable company, and one of the companies that I often go to when people ask me what vitamin companies, there's a company called Pure Encapsulations that is good quality stuff. So if you just take a small amount that's, you know, recommended on the label, it's not, I don't think it's going to hurt you. If you're taking massive amounts, it could kind of throw off some of the balance with some of your other amino acids, because it's an amino acid. So it's a little tricky. I don't think it's going to hurt anybody. It might help if you are low in that amino acid, and if you're depressed, there might be some benefit. But it's hard to draw like general conclusions about it being beneficial for everybody.
Thank you.
Thank
you, Dr. Lin. Now, usually I get to ask the first question because people don't have any, but your talk was so engaging that everybody had their questions lined up. So that's another testimony to the great job you did. I did have at least one question, and that is, you mentioned the Mediterranean diet. Is there any value or parallel to a vegetarian diet, or is there a reason not to have a vegetarian diet from a brain health point of view?
Yeah, so by vegetarian, do you mean like vegan, like no animal products whatsoever? Or do you mean just...
I was just thinking no meat, but
okay.
I realize there are all kinds of flavors of vegetarian.
Right. Yeah, no, a vegetarian diet that is in general, I mean, there's vegetarian diets that are like full of junk food. Like I have a young niece who went vegetarian. So she would go to McDonald's, order the big meal deal, and then take out the hamburger patty and then just eat everything else. So she was vegetarian, but it really wasn't a healthy vegetarian diet. So if you're including like, you know, the whole, you know, what they say, eat the rainbow, you know, if you're including all those different fruits and vegetables, some beans, grains, you do not need any meat in order for it wouldn't be any healthier if you to add meat to that. So you can get all the nutrients you need eating vegetables, with the exception of vitamin B12, which is really, I mean, there's a couple of weird sources like algae, but in general, you really can't get vitamin B12 unless you have an animal product. And so that kind of tells me that we were sort of designed to eat mostly plants, but with at least an occasional animal product, like maybe a bit of wild game or an egg or something like that occasionally. But in general, vegetarian diets, if you're not like my niece and you eat just lots of fruits and vegetables, then and beans and rice and nuts and things, it's a perfectly healthy diet.
Thank you very much.
Mhm.
I had one other question, and that is so much of what goes on in the brain is a reaction. In other words, if we eat too much of one thing, our brains sometimes adjust to that. And then, of course, if we go, I mean, alcohol and drugs are the well-known example of developing tolerance to the different things. Do we develop tolerance to elements of our diet, whether it's, or even to vitamins? And does the brain make adjustments if we take too many of them, or at least try to?
I think that if we're just talking about nutrients in food, I don't think there would be things that were like, if you're eating just a sort of a balanced diet, I don't think there would be a risk for like overdoing something so much that you would get a tolerance to it, that then if you didn't have that, you would have a bad reaction, which I think is maybe what you're getting at. Now, if you take a lot of supplements, trying to remember, there was something about that I read. I think it was back in the day, years ago, people would sometimes take like mega doses of vitamin C. And then they would if you suddenly stopped, they would get some symptoms of vitamin C deficiency, like scurvy, because their body had to adjust to these massive amounts that were really toxic at that level almost, but their body adjusted and they got used to like excreting massive amounts. So then suddenly they stopped taking that amount, the 20 grams or whatever it was of vitamin C. Then they kind of went to like a weird kind of like a rebound kind of withdrawal syndrome. But in general, I don't think that's the case. I don't think that's really a problem.
Thank you very much. And everyone join me in thanking our speaker. This was an outstanding presentation. Thank you very much. And if it's possible for you to send me a PDF of your charts, we'll go ahead and put those up with your presentation in case people want to go look at them again.
Happy to.
Thank you. And thank you for all our participants. This was an absolutely great talk.
Oh, thank you so much. Well, thanks for being such a great audience.